it is suitable for general family viewing.
Ladies and gentlemen, welcome again to Body Garage, the art of well-being. I'm your host, Dr. Chepsi. Today we are going to have a discussion about cervical cancer, and maybe you've heard a lot about this menace so far, but cervical cancer is among the fourth leading cancers among women globally. And that is of major concern because that's what we want to talk about today. And 90% of about 300,000 deaths of cervical cancer are found in the low and middle income countries where Kenya falls under. And therefore, this means that the burden is distributed to us, the low and middle income countries. And that is the discussion we want to have. And we have our guest today, Dr. Musalia. Karibu sana.
Asante.
Yes.
Asante. Yes.
Pleasure to have you.
Sure.
Yeah. Before we go into the discussion of today about cervical cancer, our viewers always love to know their guests, who they are.
Yeah.
Yes, if you don't mind, just telling us who you are, what you practice, your expertise. Yeah.
Sure. Yeah. As you earlier said, I am Dr. Musalia Wycliffe. I am a gynecologic oncologist. I practice mainly at Kenyatta National Hospital as a subspecialist in gyne-oncology. I also do teach at the University of Nairobi. And aside from that, I run a private practice, group practice with a team of colleagues, majoring in gyne-oncology, and we go by the name Medat Gyne-Oncology Center, which is at Upper Hill, 40 Suites. Yes.
Pleasure.
Yeah, sure.
Now, when you say gyne-oncology, for the people, that's a big term. What is it?
Yes, yeah. Gyne-oncology basically is a specialist who specializes in cancer affecting the genital and the reproductive health organs of a woman. So it's basically a cancer specialist for women. Yeah.
So that we are talking about cancer of the cervix, cancer of the uterus, cancer of the ovary.
Yes.
Do you also deal with the cancer of the breast?
Well, in terms of just screening and making diagnosis, but the specific management usually will refer to the breast surgeon. There are surgeons who now have specialized specifically to just deal with the disease of the breast. So they are called breast surgeons. So when we make a diagnosis, we refer the woman to these colleagues who now are able to offer the specific treatment. Yeah.
All right. Great. At least our viewers have understood when they hear the word gyne-oncology.
Yes, yeah.
And maybe they might need those services.
Yeah, many of them just know the general gyne, but now we have specialists who have trained specifically to treat cancer affecting women. Yeah.
Right. So out of all the cancers that affect women, today we are talking specifically about cervical cancer, right? And before we go into cervical cancer, I have a few numbers here. It is said that cervical cancer is the fourth most common cancer in women, with 600,000 cases every year, about 300,000 deaths, and most of these are happening in low and middle income countries.
Sure.
Why?
Yeah. Why?
Why not Europe? Why not America?
Yes, I think the good news is that although cervical cancer causes a lot of disease and death, it is preventable. And what has happened is that in the developed countries, they have been able to put in place the prevention programs, which are majorly two. One is vaccination, and then the other one is screening and treatment of conditions which now ultimately lead to the cancer. We call them the pre-cancer stage. And so women in these countries receive vaccination in childhood. We call it preteen vaccination. And then when they are active sexually, they'll go through regular screening. And these two strategies are able to prevent women from now developing the cancer disease. Yeah.
So we can, is it right to say we can confidently say that cervical cancer is becoming one of the cancers that we can prevent?
Not becoming, it is preventable. It is. Yeah, it is a preventable disease. So the main problem why we are having it here, causing a lot of disease, is because we have not effectively rolled out the prevention programs. Yeah.
There's this challenge with the preventive programs, all right?
Yes.
All right. Now, let's look at the basics of cervical cancer. What is this thing?
Yeah, it's a cancer, and when we talk about cancer, we know we have cells which are growing at a rate which is uncontrolled. So you start with a small lump, and within a couple of months to years is a big growth, and it's going all over the body and destroying your body tissues. So how do you get this cancer? Cervical cancer is majorly caused by infection by a virus, and this virus we call it HPV. Many of us are familiar with the HIV virus. So it is a similar virus, okay? And what happens is that women get this infection early in their reproductive life when they become sexually active. So it is sexually transmitted, okay? And when the cervix gets infected with this virus, the virus is so common, like common cold. So nobody should feel guilty that they got the infection, okay? It's very common virus. Majority of the women who get the HPV infection will recover, like 90%. But about 10%, because of the specific strain of the virus that has infected them, the virus persists. And it will stay. Usually it is infecting the genital skin all the way to the cervix. So it likes the cervical skin. Maybe if we were to use this little gadget here, which is just something to highlight, out here is probably the outside of the genital tract, and here is the vagina, and then we go all the way to the cervix. So this cervix, around the entrance, the cervix of a woman looks like a nostril. So just around the entrance to the cervix, this is where the virus likes infecting. And so when it infects there and the infection does not clear, it persists, then it transforms the cells on the vagina, on the cervical skin to become abnormal. And they will remain in abnormal state for some time, like 5 to 10 years. And if nothing is done to these abnormal cells, then they break through, they start becoming haywire, and they enter now into the substance of the cervix and the rest of the adjacent tissues. And that is the point where we are now saying you have developed cancer. Yes.
So by the time somebody is having now the final diagnosis of cancer, it is not something that happened 1 month ago.
No,
it is something
it's a long period, 10 to 20 years. Yes. So from the time you get the infection to the time you develop the actual cancer is a long period. And that's why we have that window of opportunity to intervene and now do what we call sort of secondary prevention, where we remove these abnormal cells from the cervix through some form of treatment. And if we are able to remove them, then again you have prevented the woman from developing cancer. Yes.
Most of the women will come to the hospital when they are already feeling symptoms that are particularly for the cancer, right?
Yes.
Is there some things that somebody can start feeling early to just note that it's HPV virus only?
No. Actually, that is now the problem. You know, unlike a flu, where you get a bit of discharge from your nostril, when your cervix gets infected with HPV, it's completely quiet and looks absolutely normal to the eye. If you were to look at it like this, it just looks a healthy cervix. but it has the infection. So the infection is what we normally would say in medical terms asymptomatic, no symptoms. Yes. By the time you start to see something, then now it's already advanced. Yes.
So how can we then pick this HPV vaccine early? HPV virus, the virus, how can we pick it early?
Early pickup is just by testing. Yes. So women, once they become sexually active, as I said, this thing is as common cold. Okay? So there are two things surrounding it. If you test too early in a woman's sexual life, you'll pick almost everybody positive and create a lot of panic. Yeah, so normally we say for HPV testing, the ultimate age, unless somebody is HIV positive, to start testing should be between 25 to 30. 25 to 30. Yes, you can have your first HPV test. Yes, but if you are HIV positive, then because of the different biology of this disease, we can do your testing a little earlier. Yes. Yeah. The other thing sometimes we can say, of course, if a woman knows when they became sexually active, then we can start maybe 3 years later. But most guidelines talk of 25 to 30, so that the women who get the infection and get sort of natural healing from the infection, you have isolated them from the population. So by the time you are reaching 25 to 30, if for sure this infection is there, then it falls in the persistent disease category. Yes. And we need to do something about it. Yeah. Now,
the HPV infection itself is quite silent. What are some? You've said it's quite a silent, asymptomatic.
Yes, there's nothing.
Yeah. What about now? What are some of the symptoms that a woman can start using to pick early to suspect that something is not right?
Nothing. When we are talking about, that is why a woman does not need to feel something to come and see a gynecologist for testing of HPV. Okay? And we should make that very clear, because that is the mistake many people will make. A woman does not need to feel anything or have a discharge to come and see a gynecologist for HPV testing. The only criteria is your age. Have you reached the age of 25? Have you been sexually active? It is time to go for your HPV test. That is all. Yes.
Now, that is for the HPV infection, right?
Yes.
Now we are talking about the cancer itself. What are some of the early signs that we are going to see?
Now, yes, usually what happens is if now you've gotten the infection, you never went for any testing, okay? There are various tests we will do to try and pick the abnormal cells. So the abnormal cells have been hanging around your cervix for a long time. Now, they are growing, okay? And now, the cells break through the cervical skin. So you see your skin, like the palm of my hand, is smooth and intact. Even if you hit it, nothing, okay? It's just clean hand, okay? You touch something, it is okay. But when this skin of the cervix gets now those abnormal cells which have reached the cancer stage, it ulcerates or it breaks down easily. If you hit it, it cracks easily, it starts to bleed, okay? So the first sign will be some sort of spotting. And most of this spotting will be on contact. So we talk about it as contact bleeding. So if this woman is in a relationship where she's sexually active, she will notice that anytime they are intimate with a partner, there's some spotting which is occurring. Yes, so that is the earliest sign that there could be something wrong with that cervix, and she needs to come we check. Other signs which come up are usually late. Now, if this skin, now you have also neglected, you've had some bleeding, now there will be bleeding even if there is no contact. Even if you are not because the growth is growing and it's not covered with skin, so it just bleeds. It bleeds. So the other sign could just be bleeding with or without contact. Then again, we could have things like abnormal discharge. The cells, they require a lot of blood supply and the like, and usually they allow to grow that blood supply, and they start to die off. So that dead tissue will present like abnormal discharge. The other thing, of course, since it's an ulcer, it can get an infection. Again, that will present like some discharge. So they will see some abnormal discharge. Things like pain are late signs. Okay? If you start feeling pain down there, then we know this disease is quite advanced. So the main ones would just be bleeding and then some abnormal discharge. Yes.
When you mention about some contact bleeding, you know, for many people, you know, if there is some pain during intimacy and some bleeding, it will be said that the man is really good in bed.
Well.
So we can take a different perspective.
Yeah, of course, yeah, but now this is different.
So it's good to pay attention and not just assume the
bleeding. Of course, if we are assuming this is a man you have been with for a while. See, different communities have different sexual practices. There are those girls who get married as virgins. So of course, when the hymen is broken, there will be some bit of bleeding. That is not what we are talking about. We are talking about somebody you've always been with. There has not been any bleeding, but now of late you notice anytime you become intimate, there's some bleeding. Yes, so that is the one that we want you to come so that we can check and see where is this spotting, this little bleeding coming from, because it should not be there.
All right. We will take a pause, we take a break, and when we come back, we will talk more about this specific virus, HPV. Stay tuned.
Okay.
You are watching Body Garage, the Art of Wellbeing, and we are talking about cervical cancer with Dr. Musalia. So when we started, we talked briefly about the main culprit of eventually perpetuating the cervical cancer, that is the HPV, the human papilloma virus. So if we can talk about that a bit more. So let's start. You said it's almost like HIV virus, but how different is HPV?
They are different because, okay, you know, maybe what people need to understand is viruses is a big population of organisms. It's like saying animals, okay, or plants. So viruses, like if you talk about animals, there are many types of animals. There are elephants, there are lions, you know. So, yeah, so HPV virus is a type of virus we call is a DNA virus. HIV virus, we call it an RNA virus, okay? So that is one difference, okay? The other difference is that HPV virus, as I said initially, people recover from this viral infection, 90%. That is why I equated it to a flu, because flu, when we get it, most people tend to recover from the flu infection. But of course, there will be those who will have a seasonal flu attacks and the like, okay? So the difference now, again, comes in now when there is this persistence of the infection. When this virus, what it does is that it gets into your cell, okay, and takes over the running. It's like a hostile takeover, okay, of your cell. So it starts to drive the cell to do things that it wants it to do, mostly to reproduce more of the virus, okay? But it is a very ambitious virus, okay? So some of the viral protein, okay, when incorporated into our cells around the cervix, it gives these cells potential for transformation in a manner that they themselves are unable to regulate their growth. And that is the stage we say now you have developed cancer. Because the cell now, which initially had regulated growth, it could not grow to break its own skin or invade into the adjacent tissues. It's a disciplined behavior. The cell now that is infected with the HPV over a long period of time has a disciplined behavior and disciplined growth. So it breaks growing outside the skin and invading into the adjacent tissue, and that is a cancer cell now. Yeah.
Mm-hmm. Right. So you mentioned that this HPV, the virus, is a sexually transmitted infection.
Sure.
Right?
Sure. Yes.
Let's talk about that. How frequently or how do you find it in your practice? Is it that most of the women that are diagnosed with HPV infections and the cancer itself, is it that they had multiple sexual partners?
Well, I think this is an infection which is transmitted through direct contact, okay? So it's not airborne, okay, that you put on a mask, then now you can prevent yourself from HPV infection. You get into contact, it's like a droplet sort of thing. So you get into contact with the infected material and it latches onto your skin and you pick up the infection, okay? So when you look at it, given that the person who is to give it to you, if you hug them, you'll not pick it, okay? Because it is hiding, say if it's a woman, on the cervix. And if it's a man, it's hiding on the penile shaft, okay? The skin, the foreskin of the penile shaft. So even if you hug the man, you're not going to pick the infection. The man has to bring his penile skin in direct contact with your tissues. Again, tissues where the virus likes to grow. So this will be tissues either on the genital skin of the man or the genital skin of the woman. The other area where it has been found to latch is on the throat, okay? So people who have oral sex can also get the virus latching in their throat and growing there, okay? Or around the anal skin. So people who are also homosexuals will have the virus growing in the anal canal, okay? So that is where you'll find, now we say it is majorly sexually transmitted. Yes. There's a bit of what we say mother to child transmission, okay? But not much disease has been seen in that segment of women, segment of children. Most of the time, maybe if it happens like that, children will develop something in their throat, okay? Yeah, so the major way of acquiring the virus is through sexual contact. Yes, and this is now where we look at it if something is sexually transmitted. So when can you be at risk?
Yes, exactly.
Okay, when do you become at risk of getting the virus? You become at risk the more sexual contact you have. If you have sexual contact with one partner, you reduce your risk. Because you see, the moment you come into contact with someone, you come into contact with their prior history, prior sexual experiences. So if you come into contact with a man, any woman he has slept with, and the woman, the number of men that woman, so you see, it's sort of like a tree behind every sexual contact, okay? And that is why we say you have to, the same sort of things we talk about when it comes to HIV. Abstinence, reducing your number of sexual partners, using condoms to a limited extent will help prevent this virus. But not to forget what we talked about, because we talked about our countries having more of this disease than the developed world. Remember, the key thing with HPV is we have a vaccine, which if you got, now even if you come into contact with the virus, the chance of it having a persistent infection reduces because you have good immunity. So it clears.
We will talk about the vaccine later.
Yes.
But let's still on the transmission of the HPV, right? So who transmits it more? Is it the men? the men might not get the cervical cancer, but are they men perpetrating the spread of the HPV, the virus, more than women?
I don't know how you want to look at it that way. Yeah. The woman will get the virus from a sexual contact. So supposing it was woman to woman, and the virus is hidden deep on the cervix, you can see the challenges of this virus passing from one woman to the next, okay, client, okay? So it is easy to say a man is able to pass it to the woman because now there are secretions, these secretions, semen and whatever, and the contact of the two sexual organs, okay, allows for easier transmission of the virus from the man to the woman. Likewise, when a man gets into contact with the woman, if the woman had the infection, because of the penetration, the act of penetration, it allows you to pick it from deep in the genital tract. Yes. So we are not going to say men pass it more to women or women pass it more to men. Yeah. It is just that if you're looking at a heterosexual relationship, it is likely to transmit the virus more. Okay? Of course, men who have sex with men are also likely to transmit it to one another like that because penetration is always there. So penetrative, maybe let me just say, penetrative intercourse is likely to lead to more transmission of the virus than other forms of sexual expression. Yeah.
Let's talk about the early sexual onset and the HPV and the virus, and then later on developing the cancer. Is there a relationship?
Sure. Yes, yeah, there is a very specific relationship. When the girl is young, just getting into teenagehood, adolescence, and they become sexually active, what you'll find is that their genital skin, especially around the cervix, is still not very well developed. Okay, so normally you will find this virus, even when we say it likes the cervix, it doesn't grow on the surface. It has to follow a crack on the cervix and grows on the cells deep on the cervical skin. So if your skin is not having a crack, again it cannot penetrate. So what we find is that young girls or women who have an inflamed cervix, an infected cervix, it is likely to have a crack. And this allows the virus now to go into the deep cells and now hatch there. Yes. So that is why you will find we advise against early sexual debut, okay? To allow your skin to mature so that it doesn't crack easily on contact. Yes. Or if you have some infection, treat it, because that helps to prevent. If your skin is infected, it easily gets bruised, and that allows the crack to get in and the virus to penetrate the skin. Yes. Yeah.
There's something also that...
Like now, if I wash my hands, they are clean. If I dip them into HPV, chance of getting infection, assuming my hands are the cervix, are minimal. But if I get a crack on my hand and I dip into HPV infected fluid, then the chance of getting infected are higher. Yes.
Apart from HIV, any other thing that happens in our body outside in the reproductive system that can increase the likelihood of developing cervical cancer?
Yeah, just the usual things I talked about. If you have any other STI, okay, it increases the risk. If you are a smoker, okay, it increases the risk. If you take a lot of alcohol, all these things have a way they lower immunity, okay? And what else? So smoking, alcohol intake, having other STIs. There are some also viral infections which affect the cervix, like herpes, if you have that. So again, this tend to drive you towards faster development of the cancer. Yes, of course, if you have an immune problem, you may be people who are diabetic, they've had maybe transplant, they have other cancers. this journey towards cancer is like now on a fast lane. Yes.
So it looks like generally something that might lower the body immune overly can increase.
Yes. Sure. Yes.
Great. We are going to take a break, and when we are back, we will talk about the HPV vaccine.
Okay.
Stay tuned. Welcome back. Thank you for watching Body Garage. We are discussing about cervical cancer, and right now, Dr. Musalia, the HPV vaccine. You know, initially it is very uncommon, especially in our African context, to hear that there is a vaccine for cancer. You know, we are used to vaccines for, you know, for flu, vaccines for pneumonia, for meningitis, but not that common for cancer. How far are we in Kenya? The government rolled out, is it 5 years are over yet? Not yet, right? Since the HPV vaccine was rolled out. How is the going on the rollout?
Yeah, I think, okay, we started off slow because one, as you said, it was strange trying to vaccinate preteens. Most of the vaccine programs we've had target under 5s, okay? Yes. So, and there's generally been good acceptance of that vaccination program. Parents do take their children to the health centers for vaccination. But a late vaccine coming at the age of 9, 10, now there was a lot of mystery surrounding what is this, okay? And many people also did not understand this cancer story, okay, of cancer of the cervix. Now, you know, yes, it is common, okay, but again, not very common. Maybe an average family may not have had somebody who has had cancer of the cervix. Yeah, no, just in the immediate, okay, but it's there. It's there. I think as more women get this infection, I think you will come across cases, okay. So many people did not have a direct experience with cancer of the cervix. So when they were being told to go for this vaccination, they felt like, what for? I've not seen anybody with it. Okay, why should I take the vaccine? So this is why we are creating this awareness, so that people learn that this disease is there. The other problem is, you see now, when people die, we also have this stigma surrounding cancer. Many of our people will not say so and so died of cancer. They will just want to sort of hide it, yes, because of the journey you go through before you die of cancer. Yes, so you'll find that maybe if somebody has cancer in the family, the information is sort of protected, because ultimately, maybe depending on the stage you are diagnosed, you're going to die. And nobody wants to announce to the world that you're going to die. Okay? So, as I say, in the initial years, the uptake was very low. Like you'll find 1 in 10. 1 in 10 of the eligible girls. We are saying girls who are between 9 to 15 years. Okay? So, if you go into a village, we will count them. Okay? And you find here we have 100 girls who are between 9 to 15. So, these are the ones who need to get the vaccine. But now these are 100, maybe if you are lucky, 10 will come, 90 will not come. So that was the initial experience, and many people got frustrated. But because of awareness, it is picking up. We are reaching maybe between 20 to 30 there, okay, depending on the settings. So 20 to 30%, that is where we are at the moment. So you still have 70% of the, in some places it is still as low as less. You know, when we talk like that, we are taking whole country statistics. So that is how it works.
True.
Yes.
Sure. There are a few myths that surround people's uptake of these vaccines. There's myths like, you know, why are you targeting girls at the age of 10? You want to make them sterile and not be able to bear children in future. Okay?
Yes.
The second one, we'll just talk about those two. That it can prevent fertility or not able to be pregnant. Secondly is that it will increase the sexual promiscuity. Those two. Okay. You know, if you tell me this one has prevented the future problem, then I'll say, oh, no need then to...
Africans and people in the developing world are always suspicious of something developed by the West, okay? Actually, this vaccine was developed initially in Australia, okay? Then from Australia, it spread to the rest of the developed countries. So sometimes people come in, they feel the Mzungu wants to control growth of the African population. They have put something in this thing. We will not be able to give birth when we take it. But that is not true. Many women have taken it. I think the challenge we have is now, as we go forward, women who are vaccinated will now come and testify. I think the Bible says maybe you can win people easily through word of testimony. So when these girls now who have been vaccinated start giving birth, that will probably change that narrative a lot.
So it does not prevent somebody from...
No. It's against the infection. If you say it like that, you would even say even measles. You know, we've heard even stories surrounding tetanus, which we give to... sometimes the ministry came up with a guideline, Ministry of Health, to try and vaccinate women, immunize women against tetanus, even if they are not pregnant. And you remember people are like, no. We will have to wait until they become pregnant. Yes, so myths are always there, but they are not factual, okay? Sexual promiscuity, in fact, we advise women to continue to observe good sexual practices, healthy sexual practices, even after vaccination. Yes, because there are other things that can happen to you. You can get unwanted pregnancy. We know it goes with just errant sexual behavior. You are unlikely to concentrate on your studies if you just get hooked to sex. So there are many things which are associated with sexual behavior aside from HPV. So women should maintain healthy sexual behavior even after vaccination. Yeah.
All right. Because of time, we are going to wrap it up, but everybody is encouraged to take their children for the vaccination.
Sure.
Is it girls only?
Even boys can get, but at the moment, the program is targeting girls, okay?
From the age of
9 to 15, yes. Women older than that can get the vaccine. It's commercially available. But because it is free in government health centers, donor funded, the cohort that was identified was 9 to 15. That does not mean if you are 16 and you want it, you cannot get it. If you come to any of our other service providers, gynecologists in private practice, major private hospital, they have it in stock. They'll give it to you. Yes.
As we finish, what is the way forward? And this in relation to COGS, you as the organization together with the government, what is in plan in terms of when you look at this year's theme for the cervical cancer awareness, January 2024, is learn, prevent, and screen. What is in place?
Yeah, it's just to go back, you know, a lot of research, programming has gone into this, okay? And the WHO came up with a strategy we call 90, 70, and 90 again.
90, 70, 90.
90, 70, 90. So we want to vaccinate 90% of the eligible girls. Okay. This will help prevent them from getting the infection. And then we also want to screen 70% of the eligible women. Eligible women is as long as you're above 25, you must have some form of screening, at least once in your life. So when we go out there and try to find out, we'll find in some places maybe 3 out of 10 women have had at least one screening test. 70% of them have never been screened at all, okay? Yet they're above 25. So we want to push that figure to 70%, okay? Then when you screen them, you might identify those who have abnormal lesions, okay? And we are saying, right now there's a problem of treating those who are identified to have abnormal cells. So 90% of these who have abnormal lesions, again, we should treat. When we do all these combined approaches, we will be able to reduce the disease burden arising from cervical cancer. Yeah, but overall, of course, what you don't know, you can't do. You cannot prevent something that you are not aware of. So that is why we need to continue learning and creating awareness so that as many people as possible come to know about this disease, and therefore they are able to take appropriate preventive action for themselves and for the communities within which they live. And that is where COGS is coming in. As we are talking to you, this is part of the creation of awareness surrounding this particular disease.
Yeah,
yes.
As we close, maybe you can take 30 seconds, speak to our viewers where they can find you.
Well, yeah. Thank you so much for listening to us today. As I said earlier, my name's Dr. Musalia Wycliffe. I'm a gynecologic oncologist. I do work at Kenyatta National Hospital and teach at the University of Nairobi. And you can find me in my private office at Upper Hill 40 Suites, 3rd floor, room 303. That is where I do my private practice. Thank you so much.
Thank you so much. As we've come to the end of our discussion today. Thank you to all the viewers for watching our show this far. As the theme for this year, for the month of January, to create awareness on cervical cancer is to learn, prevent, and screen. And you've heard about the principle of screening 90% of the girls, vaccinating 90% of the girls, screening 70% of the women, and treating 90% of those who are found to have different levels of issues with the cervix. Stay tuned until next Thursday. We appreciate you. My name is Dr. Chepsi.